Welcome back to Studio 701. When it comes to your dental health, you want the facts.
The facts, that's right. And Mikaila Davidson is a dental hygienist with Polish Dental, but along with breaking up plaque on your teeth, she's also really good at breaking up dental myths. Take a look. What are some myths that we want to debunk today?
Okay, so one of the first ones is that just because when you're brushing or flossing you see some bleeding, you should stop. A lot of people come in and they'll say, well, it hurts when I brush, or I notice a lot of bleeding when I floss, and so I just totally quit. And that's the worst thing that you can do. Anytime we see bleeding gums, that's an indication that that gum tissue is not healthy. It could be inflamed, could be due to a lot of different things, but typically once you start brushing and flossing regularly, after a week or two, that gum tissue is really going to heal up and you shouldn't notice the bleeding or even have that tenderness.
Along the lines of brushing.
Yes.
Talking about the pressure we use when we brush. I know that's something that I've had to chill back on because for some reason it's like when you're in a hurry, sometimes you tend to brush harder. What can you tell us about that?
Yep, so another one that we hear all the time is that the harder you brush, the cleaner your teeth are going to be. And kind of same thing here. Actually, you're wearing away that outer layer of enamel, causing some wear to the gum tissue as well as the teeth, which kind of increases the sensitivity of your teeth and can cause some other problems as well. So always use light pressure when brushing. A Sonicare or an electric toothbrush is one of the best things that you can do. A lot of them have built-in pressure sensors. So if you're brushing really hard, it'll, flash a light or make a different sound, and then to kind of ease up when you're brushing. So that's kind of cool.
Yeah, that's really helpful.
It is.
Okay, you have young kids, I have young kids. We talk about brushing kids' teeth a lot on this show. But what can you tell us about whether kids need to brush their teeth? Some people out there think they're going to fall out anyway.
Yeah. And they will. Most of the time, if they have all of their permanent teeth, they'll lose all their baby teeth. But those baby teeth are so important to help hold the space for those permanent teeth when they come in. Some of the teeth they won't lose till they're 12, some even 13. And so if they're not brushing at, say, age 5, that could cause some problems with those teeth that we need in there for another, 5 or 6 years or even more than that. It also helps set those kids up to have good habits as they get older, so that as adults they're practicing good habits, they're not ending up with a lot of cavities, and just having a better overall experience when they do come into the dentist.
I bet the tooth fairy pays out more too if she can tell that you've been brushing those teeth well.
Right?
Okay. Speaking of your teeth and what they look like, a lot of us think sugar is the main culprit in tooth decay, but that isn't always the case.
Right. So definitely contributes to decay, but it's actually the bacteria that feeds off of the sugar. I know we've talked about this before on the show too, but everybody has a different pH in their mouth, different saliva composition. So sometimes you are going to be just more prone to getting decay. But that doesn't mean that if you're using a fluoride toothpaste, a mouth rinse, that there are things you can do to kind of fight off that risk of decay. So it doesn't mean you should go eat tons of sugar, but it also doesn't mean that if you have something on occasion that you're going to be destined for a bunch of cavities.
I've never seen time fly like when you have to go see your dentist every 6 months.
Right?
It's like, wow, it's already been 6 months.
I know.
But another myth has to do with how often we come to see you guys. And, whether regular visits are needed if maybe you're not feeling any discomfort.
Right. So a lot of times when things are starting and they're small, such as a cavity, you're not going to feel that sensitivity initially. Some people do, but most people don't. And with the way that technology has really evolved, with digital x-rays especially, if you do have a cavity that's really small, we can treat it before it turns into a crown or a root canal or even taking the tooth out. And the same kind of goes with periodontal disease. If you have a little bit of inflammation and you come in regularly, you get everything cleaned up really well, and you stick with those regular visits, not only are the cleanings a lot easier, but your risk of gingivitis, periodontal disease, losing teeth because of that also is reduced significantly.
Plus, you get to catch up with your favorite dental hygienist.
Yes, of course.
And I love the feeling after when you feel so clean every 6 months. Like that is truly the best. But,
absolutely.
Thank you, Mikaila.
Yes,
Hope we have debunked some great dental myths today.
Yes,
so
thanks for having me.
All right, and Polish Dental is located in Bismarck and accepting new patients. They utilize state-of-the-art technology with dental care and create personalized treatment plans for their patients' individual needs. To schedule an appointment, call them at 701-222-4746. It's easy to remember. It's 222-GRIN.
All right, keep it here.